Hi, everybody. Welcome back to Coming in Hot with Caroline. First of all, I am so excited because I'm a little bit of a disaster with my skin. And you know that I'm terrified of the dermatologist. So we had to call an expert in. Not only is she gorgeous, smart, talented, but she's an expert in cosmetic dermatology. I just got excited. Dr. Dendy Engelman is here, and we really wanted to dig in and we wanted to dig deep. Dr. Dendy, we're so excited to have you here because I think women, especially in midlife, and we're going to talk about all ages, but I do think women in midlife, I'm 52, skin becomes a real sign of aging. Right. And I think that's something that women genuinely start to panic. They start to freak out. And I think they start to avoid the mirror, which you know I'm completely against. So I want to just dig deep with you because obviously you're stunning. Your skin looks gorgeous, but obviously it goes deeper than that. I want to understand your passion, why you got into this. And I know that you are all about promoting women and healthy aging and looking fabulous in your skin, any age you are. Doctor, welcome to the show. Thank you for being here. And will you tell us a little bit about your background?
Absolutely. So I'm from South Carolina and I come from a very medical family. And I always wanted to be a doctor since I was in the 10th grade. I was very intrigued by dermatology because it's a very visual field where if someone has psoriasis, you can see it the second they walk in, and you know when they become your patient, whether it's getting better or worse. And there's this real connection with the patient, I find, with dermatology because your patients can see what you're doing. I mean, if you have hypertension or high cholesterol, the doctor is telling you your numbers, but you're not really feeling or seeing the difference when they're managed. But there's a real psychological connection with my patients that I love. And of course, that extends to the aesthetic side of it, where if someone comes in and they don't like something about themselves, that too is very emotional and can make patients quite vulnerable. And one of my mom's a therapist and my dad's the doctor. One of my majors was psych. And so I really like how that comes together in allowing for me to meet my patient, hear what they're saying, what they don't love about themselves or what they wish they could improve upon. And then that transformation that occurs in our exam room, for example, with filler or something that's immediate, and they can see that the volume loss or the line or the wrinkle that was bothering them is now corrected in a matter of minutes. And I always joke that the patient who walks in is not the patient who walks out because they really carry themselves differently. Their shoulders are back, their head is higher, and that really translates into all aspects of life. We know if you feel good about how you look, you tend to be a better friend, a better worker, a better spouse, a better mama, whatever it is, life's not so bad. And the reverse is true. We've all been at a party and looked in the mirror and been like, oh, I was having such a good time, but I look terrible or I look tired. I like that play of the physicality, but also the emotional and the psychological that comes into.
I really love that you said that because it is a true belief of mine. I do think that how you look directly affects how you feel. I think it does something to your brain when you look in the mirror, why so many women avoid it. And I think it's interesting that they come to you and it is an emotional connection. Because I think people forget this doctor patient, there is an emotional connection to a woman trying to be the best version of themselves. And I think with women, there's so much insecurity, unfortunately, with society, with all the pressure that we feel. What are some of the things that you see most? What are women searching for the most when they come into your office? Because I can imagine it's pretty vulnerable.
It is. And I did a fellowship in skin cancer surgery, and I love surgery and I love the medical aspects of what dermatology provides. But I will say that I've had more tears shed in my exam room over aesthetics or hair loss or wrinkles or skin quality or acne scars than diagnosing major skin cancers. So there is such a play with how we feel and how we feel about how we look.
So
I've
true.
seen beautiful, beautiful girls and women who weirdly are in their own head about how they look and they kind of carry themselves differently. And then we've seen people at parties or out who maybe aren't the cutest person in the room, but they feel like they are. And there's a real attractive energy to that.
Yes.
And it
Yes.
weirdly translates into how others perceive you. And so that's my job, is to help people like the way they look better. And I hold that with a great amount of importance and am honored when people come to me or somebody who I treat sends her sister or her mother to be under my care because that's a huge transfer of trust.
It really is.
What they come in complaining about in the younger ages, in your 20s, the first signs of aging are not necessarily what you would think. It's not a fine line, it's not a wrinkle, it's actually skin quality and
Okay.
it's loss of radiance. And that is there's a real medical reason for that. Our skin cell turnover slows as we age. So
Okay.
when we're really young, it's every 28 days. But as we get into our 20s, it starts to go every 30, every 32 days, and that progresses with
Okay.
age. And so if we're not releasing those top layers of keratinocytes or epidermal cells, the top layer of skin cells, then we look dull. It doesn't reflect the light as readily. And so that's when people come in and they can't put their finger on it, but they're like, I just don't look as young as I used to. And they can't pinpoint something because it's not a crow's feet. It's not a
Right.
small line. It's really what the mirror is saying back to them is what's happening physiologically in our skin changes that occur with time. And that's why we want to lean into vitamin A derivatives that accelerate your cell turnover, or AHAs, which help to exfoliate the skin to give back that more youthful glow that, we've all seen people who've overdone it in the injectable space.
Yes.
No one can ever have too perfect of skin. Like you could be 70, have an amazing skin, and that reads as vital and youthful. And no one's going to be like, oh, yeah, but her skin's too perfect for her age. That is just like
It's so
undeniably
true.
and attack it. And so, I think we have to navigate this for like what we do in our 20s, what we do in our 30s. Well, I used to just start at 20s. Now this like Sephora Kids stuff is like starting at 10. It changes throughout the decades. And there are things that we add in, and there are also things that I think we take away over time. But skincare is vital to that process, whether you see me in the office or to help to work synergistically with what we're doing,
Yeah.
or if you're not ready to see me in the office. But things you can do at home really do matter now. They used to not. 20 years ago when I was in training, we didn't have great skincare. We had Retin-A and we had pretty crappy sunscreens. And that
Yeah,
was
it's
it.
so true.
You
What
know,
do you think has really changed? Like, where do you think the change came, and what was that change that happened that we actually woke up and
I
realized
mean, I
how
think
important our skin is?
if you look at the last 30 years, the whole industry has changed
Yeah.
astronomically from not just what we do in office, which obviously that too has exploded with lasers, injectables, toxins, PRP. We used to not have very much. You only had chemical peels, maybe some microneedling, but the laser technology wasn't there.
Yeah.
And now it's really exploded. So it's so fun to be in this space because every 6 months there's something new
Right.
and always changing and always getting better. In the world of skincare, I think that companies really started to put great money and great minds behind researching and developing amazing products. And it started in the derm space. I mean, when I was an intern at Mount Sinai, I remember reading Dr. Pericone's book, and I think he was one
Yeah.
of the first to develop vitamin C and talk about topical antioxidants and what they can do in the skin, not just when we ingest them, because we all knew that
Right.
vitamin E was an antioxidant that was cytoprotective or protective at the cellular level, but we did not know its effects in the skin. And so that just started to catapult all of these other actives that are we now use and we now know so well and are like baked into our general vernacular, where before
Yes.
people they didn't know the difference between a vitamin A, a vitamin C, a vitamin E, Fullerton, ferulic acid. We have so many, all the peptides. There's so many great ingredients that truly can change the skin, where before it was just kind of like, if it feels good, you can use it. It's not really going to do a lot for your skin.
Right. Did you have your set, because you are talking about products? Or is there like a top five, like you just would not live without? Like if women, and I get that it's between 20s, 30s, 40s, 50s, our skin is different, right? Like you said, you add some things in, you take some stuff out. Is there like your secret kit that you will not live without?
Yes, I always say that. They're like my non-negotiables, and they're
Yes.
kind of like these verticals. And you can mix and match within those. And often I do that. I'm always testing products or seeing if there's something new. So it's not like it doesn't always have to be wed to like you buy the entire line of somebody's offerings, but
Right.
we need a good cleanser. And that does not have to be expensive for people who are very mindful of budget. Don't buy a $70 cleanser. Let's buy something that fits within your budget because it needs to work. But there are good over-the-counter cleansers that
Yes.
we can use to basically prep the skin for the more important things that we need to lean into that may be more worth the investment. So certainly a good cleanser, a good morning antioxidant to protect for the day. Those help to neutralize free radical damage that we get from the environment, either from ultraviolet light, from pollution, from all of the things that we do that are potentially not healthy in our life.
Yes.
That helps to neutralize those and keep on the cellular level protect the cell from being prematurely killed. SPF is critical. That is the one thing that I do like with all these tiny children getting into skincare is they seem to love SPF. I'll be 48
I
soon.
never wore it when I was young, to be honest with you.
I grew up in the South. I never wore it. I
Right. Oh
never wore
my
it. And if we
goodness.
did, it was probably like filled with parabens. Like it wasn't great. But now that's just something that is part of their routine, which I love. And
It's
I coach
amazing.
my patients into doing every day, just like you brush your teeth. It doesn't matter if it's not sunny outside, you still brush your teeth. Like that's how I kind of try to link it for them. This is going to be a
Doctor, do
behavior.
you say that it has to be 50 or 30? Do you have a number that you say it's a must? You guys stop messing around?
Yes. So the numbers through the American Academy of Dermatology, who obviously are the kind of the leaders in our field, say
Yeah.
at minimum an SPF of 30.
Okay.
And then I always say like the higher the number, the better, because we
Okay.
don't apply as much as they do when they're doing the clinical testing. And we just don't. I mean, they've done usage tests, and the amount that they do in the studies to determine what the SPF is boatloads more than what we do every day. So
Right.
the general rule of thumb is whatever's on the bottle, divide it by two, and that's probably what you're getting.
Okay.
And so in that way, the higher the better. But I also say whatever SPF you like and you're going to use and reapply, like great, that's my favorite one for you.
So
Unless
as
it's
long as you're
harmful.
using it.
Yes, that's why there are so many offerings of skincare is because everyone's nuanced with the texture, the feel, the scent, the experience. And so we can find the right SPF, we can find the right retinol, we can find the right antioxidant for you. It's just a matter of like helping to navigate that space. So I started with cleanser, antioxidant, SPF. I love for people who are concerned about aging, some kind of vitamin A derivative or a plant-based alternative like bakuchiol for
Okay.
helping to reverse signs of that starting in our like mid to late 20s. Because as we talked about, the cellular turnover will be benefited. It
Yes.
helps you if you're using a vitamin A to make your skin look more youthful because it's helping to reset that cell turnover back closer to 28 days than 50 days
Got
is
it.
like when
Okay.
you are getting into the much slower cell turnover phase. I love alpha hydroxy acids or beta hydroxy acids for once a week or twice a week to help with exfoliation and just to accelerate the release of some of those older skin cells. Eye cream, you're never too young for an eye cream, I say.
How do you feel about retinol?
I love retinol.
You do, right? Okay.
That's kind of bucketed in the vitamin A that I was
Okay.
talking about for
Okay.
anti-aging. And there's so many different types. They all have different benefits. If we think about it in the prescription sense, when you and I were coming along, if someone had acne, they were prescribed Retin-A or tretinoin,
Yep.
and that converts to retinoic acid in the skin, but it's very harsh. And so people would be red and peely and burning, and their skin would hurt. And that amnestically, when I'm trying to start someone on that and they're of our age group, they're like, oh, I can't use it because
Right.
they're remembering back to when they were 18 and their skin barrier was a mess and it was a whole thing. And retinizing the skin is a real event. I'm not saying that it doesn't happen. We just need to find the right molecule and the right strength to baby step and introduce it into. So it is a little bit of a learning curve. And I love brands like Medicate who do
Yeah.
offer various steps. I think that's genius. It kind of takes the guesswork out of it because not everyone has me hand holding them, telling them how to do it.
Exactly.
So this you start low and slow and progress as your skin tolerates it. Full stop.
But
That's
doctor,
it.
this is what I love because you are about keeping it simple. I know that that's just your motto. It's like you'll get it done if it's simple, which
Mhm.
I could not agree with you more. I say that about getting dressed. Just start, just get started, keep it simple, even just a white t-shirt and jeans because if you just keep doing it, it'll become a routine, hopefully it becomes a habit. And I feel like if it's easy, we're more willing to do it and once you accomplish it, you're kind of like, "Oh, I can do that." And if it's hard, I mean, even I don't. I am terrible at night. I'm exhausted, the kids,
Yeah.
work, and that's the truth. Can I fall asleep with my makeup on? Yes. Like if I see 15 steps, I'm like, "Oh no." Like I
Overwhelmed.
just don't feel
Yeah.
like it. So I know that you really believe in that. Can you speak about that's your motto? I know, keeping it simple.
Yeah, I think the minimalistic approach, like we talked about, and obviously if I have five or six verticals, some people may be like, that doesn't sound very minimalistic, but that's divided out through the day.
Right.
We can have 3 to 4 steps in the morning, 3 to 4 steps at night. And I do think there are some people who love a 12 step like K beauty. We want the essence and like the
Yeah.
aura and all that. Sure, we can walk through that too. But the things that are truly going to benefit your skin, and I agree with you, less is more. And it's so much easier. I'm the same with you. I have little children. There are times where I'm like, I don't want to do all this. Like I'm tired and at best, can we get two, three things on?
Yeah.
Awesome. Like then we're still doing better than we would had we not done anything. And so I always talk to patients about like how long do you have at night or in the morning? Like what is your life like? How does this fit into it? And how can we make it as simple as possible, but still impactful to where you're not wasting time and effort and money, but you're still getting the real benefits of the skincare that we have now, which was not, thank goodness, the skincare of the past.
And I think what's interesting too is there's a specific age range where I think women do start forgetting about themselves. And we think it takes so much time. And we somehow think it's selfish to take care of our skin, take care of our bodies, our mental health. And I think there, especially as we age, it becomes even more important, I think, to take that little bit of time for ourselves. You know what I mean? And I think women forget that it's not selfish to look and feel your best. And I think that's something that it's become not normal. And I think we need to normalize it, doctor, because I think,
I
when
agree with
women
you.
walk out there feeling confident, beautiful skin, feeling good about themselves, I think it does just change the dynamic of their life, their family, their home life. Do you agree with that?
I mean, you should, I've never felt bad about self-care. I think that it makes you better as as on all aspects of life. Now, that doesn't mean that I'm doing like, 4 hours at the spa every weekend, but
Right.
I do feel because I see it every day. So I have to walk through with my patients, like, stop feeling guilty. This will actually make you a better human. And then once they've come on the other side of that journey, they're like, what was I so afraid of? Like, I'm so much
Yes.
happier. I mean, it really catapults them into a lot of different life changes that are great. Like they apply for the promotion that they were always
Yes.
feel worthy of. I mean, it is such a beautiful change. Now, of course, we can always get obsessed, and I'm not talking about that, but I'm just talking about like just like go get your nails done. It makes you feel better. Buy the serum even when you're worth it. Like come, let's get a laser and it's these tiny little changes that you do that really kind of reset your sense of value. And then subsequently the behavior follows, and it's really fun to
It's
watch.
so true. And it's just because, at the end of the day, it is about putting your oxygen mask on first.
Mhm.
And it is about taking care of yourself. And I always say to people, you are the special occasion because people, I'm sure you see that women start running in to see you before an
Mhm.
event, before a
Yes.
date, before
Yes.
something that they think is important. And I'm kind of just trying to remind women every day that you're important. Your life
Yes.
is important. So get up and get dressed, look fabulous, take care of yourself. It's not selfish. Like it actually does make you a better mom, a better wife, a better doctor,
Mhm.
personally, better daughter, better human, right? When
Mhm.
you're feeling your best. I think women have
Absolutely.
forgotten this.
I think so too. And I do think that when you're in the little child vortex, whatever age that
Yes.
is, I mean, I didn't have my first child till I was 39, but you're just like in survival mode and you're just kind of like, you've got breast milk on
Literally
your
survival mode.
on your body
Yeah.
and you're just like, I'm a mess and who even cares if I take a bath today? It ends up being it's not a great outcome. And so you got to like pump the brakes and realize that weirdly prioritizing your health and appearance and happiness will subsequently make you better in everything. So I
100%.
do help my patients walk through that journey. And I'm very much an advocate of self-care because not just because that's what I do, but I just think it's so vitally important to people realizing their own self-worth.
100%. And doctor, you mentioned obsession, and I think we need to touch on it because I'm sure you've seen it. And I think we can all, watching social media, watching celebrities, watching stars, we can joke around, but I'm sure there are people that can be like, I want to look exactly like her. I want to make these, unrealistic changes or expect unrealistic outcomes. How
Mhm.
do you handle that? What can you tell women? What is that piece of advice of keeping it real?
I mean, it's all part of the consultation. And when people come in with like 30 images from Instagram of like the perfect lip that they want, but
Yeah.
I'm like, we're not seeing that in proportion to that person's face. This is very important. We can all see a nose like that and be like, that's a pretty nose, but in the context of what that person looks like, and that out of context may look ridiculous for you. Like there's so
Right.
much science and math and ratios to what is considered in our world like the most beautiful lip, the most beautiful nose, where the chin is. There's tons. I mean, it's kind of like what the sculptors used to recreate in these ideas of beauty. And if you put Angelina's lips on a very
Right.
small face that has very delicate features, it would look cartoonish. We have that conversation, and I want them to be the best version of them, but I do not want to change them into something they're not. And if so, then I'm not, if that's what they're really looking for, then maybe we need to like consult plastics. And also, I'm not going to be the best doctor for you because that's not
Right.
something that I want to put my name on. I mean, I started at the beginning of this talking about how I love the visual aspect of derm, but the caveat to that is like your patients are your billboard of
Yes.
your work. And
Yes.
so, like, if someone's like, oh, I go to Dr. Dindy and they look ridiculous, like, that's on me.
Right.
And so I know that sounds a little, but the point
But it's
is, like,
true. That's so
I want to be
true.
proud of my work and I want my patients to be proud of that. And I want that to be like a very, like, beautiful aesthetic. No one's like, Caroline walked in, they're like, what'd she do? Like
Right.
that is
Right.
always the worst. And I've had patients who I've inherited from others who were like, it took a year
A
and a half
toll.
to get back to my regular self, just to start again. And so, of course, then they're traumatized, and there's a whole journey there. So you want to start with trust. I feel like I say this all the time with anybody who's putting a toe in the water of aesthetics or trying a new doctor. If you don't feel right in there for whatever reason, or if you're not in sync with what your desired outcome is, then get out of there. Don't ever be pressured into doing something that you didn't think you wanted.
Right. And doctor, are you seeing people like younger and younger coming in? I know there was, I remember when I was young, there was nose jobs, there were things in plastics, but are you
Mhm.
starting to see a little bit like, I feel like like you said, the skincare is getting younger. I've seen my friend who has like a
Everything.
9-year-old with the full fridge, all the skincare.
The
Are
jade
you
roller, I
seeing kind
know.
of an obsession getting younger?
For sure. I think that it is so normalized now, Caroline, where
Yeah.
when I first started, there were sisters who would not tell that they did Botox. Like it was just in the vault, like even husband, wives, like you could not, I mean, not that I would, because we're bound by HIPAA, but it was just a whole conversation of like, no one can know what I do. And
Right.
now I've got moms who are bringing their 6-year-olds in for their Botox. And I'm like, do you want them to wait in the waiting room? And they're like, oh, they can see this. Like, it's like going to the
Oh,
dentist for a cleaning for them,
it's so
thinking
normalized now. Yeah.
it's so normalized. And I think,
Think that's good or bad?
you know, it's a it's hard.
Dicey,
It's
right?
not categorically
Yeah.
bad because I do think that the world has changed where we have more offerings and we can do things to help prolong people's youthful looks with very minimal effort and treatments. So in that way, it's good. But of course, it can go totally overboard. And I have 18-year-olds who are like, it's not a matter of if, but when I need whatever. And I'm like, the one thing I cannot inject into you is your actual youth. So let's ride that out for as long. And so I'm
Ooh.
like, I'm not saying no forever. I'm just saying no right now. And I'll tell you when it's time to like embark on that. But I'm also not like, come back in 10 years. I'm like, let's talk about good skincare that's appropriate for your age. If they have acne scarring or something, like we can do peels or lasers to help with that. So there are things that we can do in office if they're just dying to embark
Do
on that journey,
something.
but it's
Yeah.
not going to be changing of their aesthetic. And that I think is the important thing for youthful people who are listening to know is like just because your older sister needed something doesn't mean you do. I see that a
Exactly.
lot.
And it's like what you
Or your
said,
best
write it
friend.
out as long as you can. I think everyone's
Yes,
like rushing to the end. And I'm like, guys, you look gorgeous. Like,
they look
wait.
gorgeous. And sometimes, and we've seen this, if you do start too young, you enter into this almost age androgynous zone where you could be 25 or you could be 45. And if your actual age is only 26, like I
That's
don't know
not
that we've
good.
accomplished the goal of what's it going to be like when we're 45 that you might look
Right.
65. I want them to like be mindful of it's not always just more to make you look better and younger.
That's so true. That is
And
so true.
so I
Doctor, will you
think
talk to us a little bit about injectables? Because I do think that's a hot topic. And I have to be honest with you, I started doing Botox at 47. I
okay.
actually really waited for whatever reason. I wasn't somebody who was always going to the dermatologist. I don't do facials and things like that for whatever reason. Now I'm getting more into it, of course, now at 52, having incredible friends, meeting incredible women like you. I've had just a much better understanding of why it's so important. And that's why I think these interviews and these conversations are so important because I don't think we're always so aware, especially our generation. My mom, we just sat in the sun all day, like literally lathered oil on me And I'm like a sun worshiper. I love a tan. I'm not somebody who loves people touching my face all the time. So now products are really important to me. And then a little touch up, a little touch up here and there. But I started Botox at 47. I waited. I thought it was great. I don't feel that chasing feeling yet. I still feel like I know when it's kind of wearing off. And I had some filler in my lip. That's all I've done. How do you feel about these injectables? What is your honest opinion?
Okay. Well, let me start by saying you're beautiful and look great and
Thank
timeless. So
you.
whatever you have great genetics and whatever you've done,
Thank you.
it's not catching up with you yet. I too was a sun worshiper. I loved it. Grew up down south. I mean, the tanner, the better. So I am in recovery as well from that. But I will say that I'm 47. We had to start young because we had to practice on each other in residency. So there was this weird, the concept of prevention was not at all there. Like nobody started Botox where I trained until like 40-ish, but
Right.
we would do it just so we could see the outcomes on each other. And so I have been Botox for 27 years. I mean, that doesn't mean I can't move and I have some
Right.
wrinkles and I can shoot a glance to my 6-year-old if
Yeah.
she's misbehaving and,
Yeah.
without having to use my words. And I think that's really important. I think we cannot take away the humanity that
Yes.
is like nonverbal communication. And so that may mean that we leave some lines. And the older we get, I think we have to be really careful with injectables of neurotoxin into the frontalis because as we age, we get a 4 millimeter drop in the brow just anatomically. So
What?
if we're adding to that relaxation, it actually makes it worse where your brow gets flat, it looks hooded, it looks angry, you look tired, people feel tired. So you actually
Uh-oh.
change your injection technique to do more. And everybody's face is different.
Right,
Obviously,
of
like
course.
very short forehead, so I don't have a lot of places to put it without it dropping. But you maximize it here in order to kind of give more of a compensatory lift. But there are
Okay.
all different techniques and things that you actually stop doing as much as you get older. It's not always just injecting more spots. So I want people to know that because they're kind of like, what do you mean? I've done my forehead for 15 years. And I'm like, well, your face is not where it was 15 years ago. And so we do get laxity and changes, not only in the dermis with collagen and elastin, but also with like the fat pads are migrating. We're
Right.
losing bone. I mean, we have so
And
many.
all this falls.
Yes.
This drives me
So we go
crazy.
from this like very youthful triangle with
Yes.
like high cheekbones and to a more aged one where there's these pre-jowls and kind of sagging.
Right.
And so you want to go to someone who understands anatomy, changes over time, what we can do to help combat that in ways that aren't obvious. Because if you have smile lines, for example, and you just keep adding filler here, over time, we've seen it a lot of people who are on TV don't have a smile line, but they don't really look human. They've lost the natural anatomical contour that is a human being. It looks more like simian or monkeyoid because they've built out
Yes.
the maxilla. So you want to actually put filler back here to help support the skin and the
Oh.
bone that was lost and give more definition to the face without even going into the line. So it seems very counterintuitive because patients will come in complaining of this and I'm injecting over here, but
Right.
it's such a beautiful outcome without looking done. They can go right back to work and it's not obvious. So the way that we've injected has definitely changed over time as the products and what we have, our tools that we now have changed. Because at first we only had hyaluronic acid that really
Right.
only added in there. And now we have more robust, like more lifting fillers that give deep support to the skin to address the changes that are happening not only in the skin, but with the entire face, with the fat pads, with the bony loss, with the laxity of like the muscle
Right.
and the fascia. I mean, it's incredible that we all look as good as we do for as long as we do because
I,
it is the tectonic plates underneath the skin of
it's
change.
like a puzzle. It
Yeah.
really
So
is.
the goal is always to kind of replace what was lost in like where you are in time. So for example, I'm 47, you start losing 1% of collagen after the age of 30 a year. When you hit menopause, that doubles. So if
What?
you think about me having 17% of my total body collagen loss, like that's a lot. We have to fill up the tank.
Right.
You don't want to
Okay.
overfill. When we overfill, then things look sideways and people start looking weird and wonky. So it's really this like these tiny tweaks of kind of keeping up with what's lost and
Right.
refilling the tank, but that fine line of not tipping over.
How often do you think someone should come in normally? I know everyone's different. I like is it every 3 months, every 6 months? What's the norm?
So for neurotoxin, most of my patients come every 3 to 4 months. And for filler, I would say usually once a year. And we don't have to do a lot. People get really scared of filler because we've seen such crazy overdone
Yeah,
work. But typically, one syringe of a hyaluronic acid filler is 1/5 of a teaspoon.
that's it.
Not a lot of volume. When we see people who look crazy, it's when they have like 20 and 30 and 40 syringes in their face. But if we're doing
Right.
like one syringe on either side to lift back, that's not a lot of volume. It's not going to stretch out the skin. All this clickbait now, because it is so normalized of
Right.
like, people over 40 shouldn't get filler. Lasers are terrible after perimenopause. Like, there's a lot of noise out there, but you do want to trust the experts who are telling you what is doing that.
Absolutely. And what do you feel,
Um,
honestly, when you're talking about number one, I definitely want to talk about Medicaid because I think it's this new way of thinking about products and a new way of making products that are actually effective, but not complicated. And I think
right.
that's what is so cool
Hard.
about it. One, I just really want to talk about quick. I know that you are not only a doctor, but you are a surgeon. And I think it's really important to talk about because skin cancer is something that is so prevalent. Both my parents had it, both had it removed. So now obviously I have to be way more careful. It definitely woke me up. And can you talk a little bit about, because I know at 52, number one, I just want to talk two quick things before we talk about Medicaid is perimenopause and menopause and your skin changes and the changes in you, because I think it's really important. A lot of us are going through it. And two, about skin cancers, what are the signs? I know that you have a specialty. Can you talk a little bit about it? Because I think it's just so cool. And I honestly didn't know that there was a technique out there that was microscopic that really got into the margins and the lines. I don't think people know that. So I think we avoid it thinking that there's no really easy treatment, but there
Right.
is.
Yeah. So the technique that you're talking about is called Mohs micrographic surgery. So Mohs is an eponym for Dr. Frederick Mohs, Mohs. A lot of people call it mole surgery, or they think it stands for something, but it's really just his last name. And what he discovered in the 40s was you could cut out the cancer. So let's say that this is the skin cancer.
Mm-hmm.
I did not plan for this. I apologize, but here's my plan. And historically, if you went to a surgeon, they would take 5 to 10 millimeters around the skin cancer to make sure that they got clean margins. Then that all goes to the lab.
Okay.
They look at it under the microscope. It's put into formalin. It gets processed. It takes about 2 weeks to get the results back. And they sew you up. And if there was more left, then they go back and take another 5 to 10 millimeters
Oh
in that area
gosh.
around the scar because they have no idea where the cancer is. The pathologist just says it's positive. So with Mohs micrographic surgery, if this is a skin cancer, you take 1 millimeter of skin around that, and then we bisect it and like map it out according to where it is on your face. So if it's north, south, east, west, if there's cancer microscopically and it's between 1 and 2 o'clock, then when I go back, I only take 1 millimeter right there. So all of this is clean. So there's
Oh
no reason
wow.
why you should cut that out. So not only are you seeing 100% of the margin, it's the most tissue preserving of all the techniques. So you're
Wow.
not just taking huge swaths of skin that never needed to be removed. And so that's really important on places like your face, your neck, your hands, your feet, the genitals, like areas where you don't have a lot of skin to spare. On the back, we can get it out pretty easily without worrying about the aesthetics of
Yes.
it. When it's on your nose, every millimeter matters. And
Yeah, my
so,
dad had like a chunk cut out.
yeah.
Honestly, it was hideous.
hmm And so that was like the old way. And so now it's much more tissue preserving. The cure rate goes through the roof because when they do the traditional way, it's a different way of processing the tissue in the lab.
Yeah.
And you really only see about 8% of the margin versus 100% of the margin. So it's
Wow.
the best way, it's the most like curative of skin cancer removals. And it's really important. And they're two different, we kind of bucket skin cancer into two different, it's either melanoma, which is the
Okay.
deadliest and like most concerning, and that's pigmented lesions. So moles that are new, changing, they tend to have pigment. If they're, we call them the ABCDEs of melanoma. So if they're
Okay.
asymmetric, irregular border, irregular color, D is for diameter, and that's 6 millimeters or larger. So like
Okay.
the eraser end of a pencil, as for
Okay.
like an idea of how big 6 millimeters is. And then E is evolving or changing. And that's really the massive metric that everyone needs to pay attention to. If you've had a mole since birth and it's just sitting there and it doesn't look any different and it's on your arm where you can watch it and take pictures of it, unlikely that that is concerning if it's totally staying the same. But if it starts to change, that's when we need to
Okay.
bring it to the experts. And that doesn't mean it comes off. It just means you need someone else to look at it
Right.
who's like an expert in that field. We have some new amazing things where you don't even have to biopsy some of these. You can use a sticker biopsy that takes the DNA and analyzes it without you even being cut and
What?
back in like 48 hours. So it's really exciting how.
Okay, it actually makes you want to go because you feel like
Right.
you don't
Because
have
then
to
you're
sit
like,
and
I don't want
wait.
to
You
be
don't
all
have to.
carved
Right.
up for like
Right.
potentially normal moles. But if you have a sticker biopsy that doesn't hurt and it can tell you, it can prognosticate for you, this is unlikely to ever turn into a skin cancer, or this has the genetic mutation that's found in a lot of melanomas, it needs to come off. Great.
Why wouldn't you?
Right.
Like knowledge is power. I know.
Right. I mean, it is easy. And I have said multiple times I come from the South, and I do think the head in the sand approach is often the one. I mean, we used to have what it was called the positive Band-Aid sign. When they'd come in with a Band-Aid, you're like, how long's that been there? They're like 4 years. And then you recover this like massive skin cancer.
That's
So,
so true. How often should
um,
we be checked, doctor? How often should we be going to our derm?
So if you've never had a skin cancer and you don't have any first degree relatives who do, then once a year is fine.
Okay.
But if you've had skin cancer or if someone in your family has had melanoma who is a first degree relative, usually we say every 6 months.
Every 6 months. Okay. And doctor, can you tell us a little bit about, just really quick, perimenopause and menopause? What are those significant changes? What helps, or what's that starting point for women who are struggling and just seeing so many physical changes? Your skin, your hair. I mean, it is a doozy when you start. I'm post-menopause and it is scary. No one talks about it. Nobody tells
No
you what's
one
going
talks.
on. No one tells you anything. So, any insight, please?
And Caroline, I will tell you, I went to school for 13 years after high school. Like that's how long my training was.
Literally.
And I had this many lectures on menopause.
See, that is outrageous to me.
So, what I will say is it is changing and it
Yeah.
is so much better now. And I've been part of some incredible conferences and like there's a real groundswell on all of the specialties. And GYNs are now getting like subspecialties in menopause. You can
Thank
find them.
God.
You can go online and see if your gynecologist offers it. If not, find one because you do not have to navigate this alone. And it is so sad how we've treated women historically. Like you're put out to pasture and we're not going to talk about it and
Yep.
we're not going to help you
Left
do
out there
it.
to die,
It's
literally.
terrible.
I know.
So I am so glad that I live in this era where there is so much more knowledge and research and money going into really helping us to navigate a time that spans like at least a decade, of all the changes. And it literally is head to toe, as you said. It's your hair, it's your skin, it's your vaginal moisture level. I mean, it's
Even your
everything,
emotions, like
your
your mental
bones, your
health.
psychological state. It's
Yes.
crazy. So we want to make sure that we're pairing up with someone who in your area, and they are out there, I promise, who can help with managing hormone levels, managing symptoms, and talking about the changes that occur. Specifically for what I do, your hair tends to thin, your skin gets more dry, it can get more red, it can get more sensitive, you can have acne. I mean, it's really runs the gamut of what you're experiencing. Nails can get brittle. It's not a great time in the beauty world, but that does not mean we can't correct it. And they're
Exactly.
not talking about like topical estrogen for the skin to help with aging. There are many ways that we can address that, either with our nutraceuticals like Nutrafol that are great to help support hair growth. And
Okay.
there's all kinds of topical things that we can do in addition to some talking about HRT. Like that whole concept has now been changed, thank God. I mean, that
Thank
huge
God.
Harvard study really set us back for 2 decades of like putting women in fear of I'm going to get cancer if I address this hormonally. So therefore, I'm just going to
Absolutely.
white knuckle it for a decade or longer until I die, which is terrible.
It's
I mean,
terrible.
no woman.
And women live longer, damn it.
We
So
do.
we need to keep ourselves healthy and strong.
Absolutely. When I was doing this panel last fall, there was amazing cardiologist out of Atlanta, Jane Morgan. And she pointed out that we as humans are the only species who lives beyond our reproductive years. And I thought that was
What?
so
That's
poignant that literally we
fascinating.
are. I mean, if you think even 100 years ago, like the life expectancy was kind of when we stopped being fertile. Like we didn't live as long as we do now.
That's
So we
great.
too were those species. And now we have to like kind of trick the body into feeling like we're fertile or
Lasting longer. Yep.
last year. And so we can do that. And no one needs to suffer alone. That's the takeaway from this. But and and I
And talk
think
to your doctor, right?
talk
Talk
to
to your
your doctor.
dermatologist. Tell
And if
them
they
what
won't
your
talk to
skin's going
you,
through.
find a new doctor because there are those who will. And I will say, I'm not demonizing those who don't want to talk about it because we really didn't train, but
Yeah.
we need to learn. Like
But we
the
know
data
better now, so
out
we need
there
to do
now.
better.
Yeah,
Don't you think, doctor? Like, we know better. We need to
for
do
sure.
better.
Yeah. And if your doctor doesn't know a lot about it, find one who does because the data.
Exactly. Doctor, I want to just finish off with talking about the incredible products that you stand behind. And I know that you are very proud of them. And can you talk to us about Medicate? Because I
Sure.
feel like it's this new booming industry with like actual simplicity and effective products, which I think is incredible. And they keep it simple. Will you talk a little bit about Medicate?
Sure. So Medicaid is a company out of the UK, and they are family founded. They're two brothers.
They're
They're
amazing.
cosmetic chemists. They're so adorable. Their dad was a pharmacist. They are so involved with all of the formulating, like every step of the way. And I really find that to be not only heartwarming, but like unique in this industry of like saturation of skincare, where
Yeah.
people aren't just following trends, they're truly innovating and they're making great products that are also impactful on the skin but easy to use. And so they went like gangbusters in the UK as they should. And then when they launched here, they got on my radar and I was just like, I love this brand. I love their ethos. I love their products. I love their
Even the
approach to
packaging
skin.
is great. I'm not kidding. I even love the packaging and the liquid peptides.
They're
What
so
is
beautiful.
that? I mean, it's like magic in a bottle.
I know they've done a beautiful job in creating products that are, still affordable. I
Yeah.
mean, they're not like break the bank, which is amazing because there's so much science behind them and they really put their money where their mouth is in doing clinical trials, making sure that they are held to a very like clean beauty standard, which I think is, the wave of
Huge.
the future that we have to not only do good for ourselves, but good for the earth and make sure that we're not exposing ourselves daily to something that could potentially be toxic.
Yeah.
And I just find that for my patients, when we're helping to like navigate this world of skincare that is so overwhelming, you put skincare into Google and you'll be served one
It
minute.
is
Or even
terrifying.
walking into CVS, it's like, where do I begin? I just wanted to come in for a face wash, and it's just hard
It's
to navigate.
intimidating.
I love that line. I feel like they do a beautiful job. I love the way that they've been mindful about some of the more effective ingredients, but also that can come with side effects like their retinol or retinaldehyde, which is better tolerated, but also the way that they increase the percentage so that you can start with a retinol naive person, or if you're already using one, you can go for a stronger percentage. And it's just makes a lot of sense. It's so easy to
They've
navigate
thought of
and
everybody.
it is very inclusive, but also you can see results really quickly, which I find as a prescriber of medication and skincare, compliance goes out the window if you're not starting to see results within 7 to 10 days. And patients just stop using it. And so we all have that like graveyard of skincare that we bought
Oh, yeah.
and
Nice little
want
bucket.
so badly to work, but it just doesn't. But you also can't bring yourself to throw it away because you spend a lot of money on it. So like these are the things that they've solved for, and I think they've done a beautiful job, and they're very wed to creating great products for everyone.
It's amazing. I am so proud to be using them. I mean, they came on my radar, and to me, I am somebody who genuinely, it has to be simple, has to be easy, and it has to be effective. Like when you said that, it has to be something that is just easy to use, grab it, and people start saying, "Oh, you look great." There is something that people all of a sudden start saying, like, "Your skin looks great," and you're like, "Oh, well, thanks." So there is something to that. So I personally love Medicate. And I'm just so glad I got to meet you and got to speak to you about this because I am not somebody who always focused on skin. And now I'm obsessed with it. And I think there is something about aging that you start to realize how important everything is. I know for me, I like really appreciate my life every single day now because I see the end a little closer. So I hope people can wake up sooner, younger, and not wait till their 50s. I hope, because there is help and there is ways to look and feel your best at any age. I genuinely believe that.
I agree with you. And I do think that skin quality is one of the like hacks to looking great and young for so much longer than all of the aggressive stuff that we put into it.
Doctor, I love that you said that. And I just like to finish off asking everyone, what are your happy tools? It's things that always put that negative energy into positive, that just kind of like if you're having a bad day, you know it's going to help you feel better.
Well, I joke that I'm incapable of internal processing. So I have an amazing mother who's a therapist who I call the word. I mean, literally from the sound of my voice when I say hello, like she can glean what's going on, good or
Love
bad.
that.
And my friends are a huge, wonderful outlet for me there. As far as a beauty hack, I love a bath. I
Yeah.
think that is such a nice ritual. I do the magnesium salts and like all the things. And I mean, often my children are in there with me or one of the two,
Oh,
but that tends to reset me.
do you get up
And
and get dressed every day, doctor?
yes, well,
Well, I know you
I,
go to work, but like on a weekend or on a day off, are you somebody that likes to put your makeup on, likes to get
oh,
dressed every day?
I can't imagine anyone ever seeing me out of the house without
Which,
makeup. That is a Southern belle in me that will not. I mean, my mama used to, or still does, goes to the gym with a full face, you know?
oh yeah, my mom says it's self-respect.
hmm I listen, that's why I don't feel bad about self-care, I think, because I grew up with that. I mean, yard work, you never left the house without
Me
something.
too. Me too. And I want to bring it back.
I
I've
mean, I don't
decided.
need it. No wonder I
Doc,
went into derm.
right. Well, thank you so much for being here. I want to let everybody know really quick that they can visit medic8.us for 20% off your first order with code coming in hot at checkout. That's MEDIK, the number 8.us, and code coming in hot to save 20%. Trust me, it's worth it. And doctor, I absolutely loved having you on. Thank you for taking the time. Thank you for sharing with us so much good information. And we love you. Thank you. Bye, guys. I'll see you next week. And coming in hot, we have more episodes coming up. And please like, review, follow. And I hope you have the best week ever. Get up, get dressed. Mwah.